Good morning, everyone. Welcome to today's Ethnic Media Services Zoom News Conference. I'm Sunita Sarabji, health editor at EMS and co-producer of our Friday briefings with my dear colleague, Pilar Marrero. This seasonal flu this year is the worst the US has experienced in 15 years. According to data from the Centers for Disease Control and Prevention, more than 29 million cases of influenza have been reported, leading to at least 370,000 hospitalizations and 16,000 deaths. That's data as of February 8th. The alarming spike in influenza cases comes amid a quademic of COVID-19, avian flu, and RSV. Yesterday, reports emerged that the FDA had canceled a regularly scheduled meeting with its advisory board, causing health experts to ponder whether this fall's vaccines will be up to date against new strains of influenza. Speakers this week will discuss the current rise in influenza cases, tips for preventing and treating the illness, underlying environmental and health factors that make certain populations, including kids and elders, more vulnerable to flu-related pneumonia, and also lower vaccination rates, I should say, sorry. Our guests today are Dr. Peter Chin Hong, Professor of Medicine and Director of the Immunocompromised Host Infectious Diseases Program at the University of California, San Francisco. Dr. Benjamin Neuman, Professor of Biology at Texas A&M University, and Daniel Turner Lloveras, co-founder and CEO of the Latino Health Innovation Alliance, Salud con Tech, and an adjunct professor of medicine at the University of California Keck School of Medicine. Speakers, EMS is indebted to each one of you for always being on hand to share your valued expertise with reporters and communities who may be in greatest need of your knowledge. We remind you to speak slowly for our Spanish, Mandarin, and Korean interpreters. Reporters, we hope you've come armed with lots of questions. Please enter them in the chat and we will take them in order as time permits. So let's begin with Dr. Peter Chin Hong, who will discuss how to protect oneself and family from getting infected, flu symptoms, how to manage an infection, how infections can turn into pneumonia, when to go to the hospital, and the greater vulnerability of children. Dr. Chin Hong, that's a tall order, but I hope you can meet it.
Yes, thank you, Sunita, and hello, everybody. So as Sunita was saying, this is one of the worst flu seasons we've had in the last 15 years. It took everyone by surprise. I remember when we were meeting with the California Department of Public Health in the late fall, the projections from the CDC was that this would be an average season, but they also said that COVID would be relatively higher than it was. So it's almost like a seesaw, and we saw much more flu and less COVID. A lot of people are wondering why. I think the reasons could be apart from us all getting together again after the pandemic, the types of flu that are circulating with more H3N2 as well as H1N1, but primarily driven by lower vaccination rates as well. When you look at kids, it dropped from about 58% in 2020 to about the mid 40s now. And similarly in adults over the age of 65, that flu vaccine rate dropped from about 52% in 1919 to 1920 to about 43% in 24-25. And interestingly, although two-thirds of the severe illness and deaths are in those over 65, a surprising number of children have been gotten seriously ill this year, including deaths. We've had about 86 kids die in the US, which is very high for flu. So far, we are not even close to the two-thirds way through, including kids in California. And in San Diego, some teens who died got a lot of press. How do you recognize flu? Well, people say that flu is different from a cold or even COVID because it's like you're minding your own business and all of a sudden you feel like you got hit by a dump truck. That is kind of like the standard sort of narrative around flu, although there could be some variation. And the thing with colds is that you get symptoms above your neck, and with flu, you get above and below your neck. So you'll get that cough, that shortness of breath, that muscle aches all over. And if anybody has symptoms right now in California and the US, more likely than not, it's going to be flu. I think more than 60% of what's going around now is probably flu, more in some areas than others. Um, when do you know? And for kids, that's sometimes hard to figure out when they're very seriously ill. Um, but it's usually not having the same appetite, being more lethargic. I think one interesting things that pediatricians have told me is that when the kid is crying, but they don't have any tears, those are all signs of dehydration from maybe from high fevers. And with older adults, of course, the older you are, the harder it is to tell if something is wrong because they don't always mount a fever. But some of the same characteristics as in COVID pneumonia would help us with flu pneumonia as well, which is shortness of breath, because the lungs is really where the most of the disease occurs in influenza. Um, the influenza can also affect other organs apart from the lungs. It's kind of like the original COVID, so it can affect the heart, the brain, other organs as well. But those are much rarer. In terms of protecting yourself, thoughts of which we're seeing now and then goes to flu B. So even if you had the flu, it can still help protect you against another.
Dr. Chinhong, you were frozen for just a few minutes. Could you
Oh,
go back a bit?
sorry about my internet connection.
No worries.
So how do you protect yourself? Well, the main way to protect yourself is still using vaccines. And people might say, isn't it too late? It's not too late for several reasons. The first is that the flu vaccine this year contains three types. And even if you've gotten flu, it changes over the season. So we see more B towards the end, and you may still have protection. But the biggest bang for the buck, of course, is if you haven't been vaccinated. The second reason is that we're still in the middle of flu. It came a little bit late. It will probably end late. And flu is notorious for having a long tail. So it goes until April, sometimes even May. So you can still get benefit from it. The third reason is that we're having this parallel outbreaks of flu in humans and bird flu. And the more you have these two flus around, the more bird flu can pick up tricks of human flu in order to enter our bodies more efficiently. The way I think about it is like bird flu and human flu, they're kind of bored with their clothes and they want to just exchange. Like bird flu wants to get the new shoes from human flu, and human flu wants to borrow the coat. So they're known for exchanging genes when they're next to each other. By getting the human flu vaccine, you can lower the chances of that gene exchange occurring because you're diminishing the chances of you even getting flu to begin with. So those are some reasons. In terms of other ways that you can get protection, people don't remember that antivirals are really important. Like Paxlovid for COVID, there's Tamiflu for influenza. You The problem with Tamiflu is that you have less time than Paxlovid for COVID. You only have 2 days, so that requires somebody to get a diagnosis. It's really beneficial in those who are older and those who are very young. And kids as young as 6 months can get, antivirals. The other, so getting a 5 day course of Tamiflu or some of the new antivirals for one day is going to be important. But the one factor that people don't realize is that one protection intervention is, say you have flu in the household, but I'm living with a very young infant and an older grandparent. and they don't have flu, I can actually ask for a prescription to give them antivirals like Tamiflu so that they don't get flu. And that is also another recommendation for antivirals. We've used that also in nursing homes for outbreaks, etc., in people, even though they're negative, to prevent from getting it because the attack rate is so high with flu. Flu is not like one of those things where it's around and you don't get it. If it's around and you get exposed to it, you're more likely than not going to experience symptoms. So that's kind of a summary of kind of where we are in flu.
And Dr. Chin Hung, when do you know that you need to take your child into the hospital if they have the flu?
So I think it usually is so in terms of RSV, it's kind of like, you get the wheezing and the is involved with flu. It's usually the big airways. So you're going to get a cough. The kid may look a little bit blue, but I think those are late signs. The early signs are really poor appetite, fatigue, listlessness, not feeding, and dehydration, which could be, again, not going to the bathroom, not having as many wet diapers, and crying without producing tears.
Right. So there are a number of questions for you. Pilar Morero, will you please ask your question?
Yeah, I was just reading an article about the flu situation in the US and in the world as well. And they were saying that the vaccine efficacy was lower for the flu this year. Is that so? And if so, that why?
So you're right, Pilar. The data, when the CDC looked at 5 countries in Latin America for their winter, which was during our summer, so several months ago, the efficacy of their vaccine was only around in the 30s, which is still in the range of efficacy of the vaccine, but it's a particularly bad year for that. We don't know what our vaccine efficacy is. It wasn't exactly the same thing. It's not exactly the same circumstances. So one that could be an explanation at the end of the day that we'll look back on and see. It does mean that we probably do need better flu vaccines eventually, like universal influenza vaccine or something better. But even if the efficacy is, say, 40%, that's 40% less people going to the hospital. So it's still beneficial. And that's why I also want to emphasize antivirals for vulnerable populations, because even if the vaccine may not work as well in somebody, or even if they didn't get vaccinated, getting access to early antivirals could be saving someone from a trip to the hospital.
Thank you. Araceli Martinez is next from La Opinion. Araceli, welcome. Please ask your question.
Hello. I was trying to find out if the numbers of people vaccinated have been lower because I think many people is tired of vaccines. So what are the numbers that you have in regard to vaccination? Is this a factor in this in the increase of the flu cases?
Yes. Yes, great question. And yes, both in kids and in older adults and in the general population. But I focus on kids and older adults because those are the two populations that do really poorly with flu. So vaccination rate in kids under 17 and under have dropped from 59% in 2019 to 2020 to 46% in 24 to 25. So that's like falling off a cliff in the vaccine world. And those over 65 and 65, the flu vaccination rates dropped from 52% in 2019 to 2020 to 43% in 2024 to 2025. I think, I think the kid issue is interesting with vaccines. And I wonder if people looked at COVID and they thought, well, my kids are going to be fine. But flu is a different beast. Flu is very, very different. And flu really targets kids. Remember what happened in swine flu in 2009. more kids got infected than people thought, and they were more impacted than and some other populations.
Dr. Chin Hong, did you disappear? There are a number of questions for him, so maybe I'll
Yeah, I think he got disconnected. He's back on. I'm going to make him co-host.
okay.
Sorry about that. My internet is a little unstable. So we have to change our narrative from kids not being at risk to kids really being at risk. And we're seeing that with measles too. So I think it is, we're talking about an infectious disease, but lack of vaccination is also infectious because we're taking our views on COVID vaccines and spreading it to childhood immunizations and immunizations across a broad array of diseases like measles, pertussis, flu, as we're seeing, things that have saved children's lives before.
Thank you. Peter Sherman, will you ask your second question? And Dr. Turner Uveras will answer your first.
Hi, sorry, I was just unmuting there. Thank you. This may seem a little bit sort of like a tangent, but I'm just curious if you can shed any light on this. I'm interested in sort of emerging science around gut health and the links to the immune system, and just wondering, Dr. Chin Hong, what your thoughts are about not whether it can prevent us catching the flu, but how it can help mitigate, for example, severity or otherwise just support us in this time of just where it seems like bugs are everywhere.
That's a great question, Peter. And unfortunately, I don't have any great answers except that, when the composition of our gut and the microbial flora probably do have a big part in preventing even viral co-infection because the bacteria have their whole ecosystem. I think in the future, what some people have proposed is that you'd get a fingerprint of somebody's microbiome, and that will help you determine, what particular therapy that individual will get. But there isn't, as I know, a big linkage, and others might know better, between gut flora and viruses currently and the severity of viruses. We know that it helps influence a lot of bacterial infections, but none that I know of. But a great question.
Vidya Sethuraman from India Post has the next question, and then I have a question before you drop off, Dr. Chin Hong. Vidya.
Hi, Sunita. Hi, doctor. So, how long do you expect this flu season to last? Like, it's been a while since it started. So, how long do you think it's going to last?
So that's a great question, Vidya. I think we don't know is the answer, but if you look at previous years, flu is known not like COVID for going up and just going down. It's kind of a long descent. And sometimes flu season can last until March, April, and it changes. So it's usually what we're seeing now, flu A, which is like H1 and H3, and it changes to flu B. So that's what usually happens in the season. So it's not only an acute season, a high peak, but a slope that goes down gently.
So I have a question for all speakers before you drop off, Dr. Chin Hong. The FDA announced yesterday that it's canceling its annual or its regularly scheduled vaccine advisory committee meeting, flu vaccine advisory committee meeting. Could each of you discuss the impacts of that on our public health, and also relatedly our pullout from the World Health Organization? Dr. Chin Hong, why don't you go first?
So I would say that flu and infectious diseases are not like, substance use necessarily, or housing or consumer goods. Infectious diseases knows or doesn't care about political affiliations or countries' borders. So to say that part of the world community is really only doing the service not only to the world but yourself. It is a two-way street. We give money to the WHO and we participate in meetings, but we get also specimens of infectious diseases from around the world. We get and samples, so that's how we got the sample to make the COVID vaccine, for example. We get early warning signs, like if something is happening in Congo, which is now, we get more information about it. Not just that something is happening, but we can know what it is in order to protect our country better and maybe even share. And then finally, of course, it is not a great symbol of us getting together in such a fractured time and pulling out also, just, it's almost like a slap in the face.
Thank you, Dr. Chin Hung. I know you have to drop off, so could you give us your 60-second soundbite for reporters?
My soundbite is that, I think even though our world is so fraught with all these infectious disease crises, we have the tools to really soften the blow on our populations. So I'm just ending on an optimistic note that also with bird flu, we're not starting off at ground zero. We have drugs, vaccines, and diagnostic tests. The problem is not the technology; it's always in implementing the technology so that all our populations would benefit.
Thank you for joining us. We really appreciate it. Dr. Turner Yerveros, thank you for joining us. I'd like to ask you the same question that I asked Dr. Chin Hung. What is your take on the FDA canceling its meeting with its flu vaccine advisory board?
Sure. Thank you for inviting me. I think canceling any kind of meeting like this is a statement in itself, and that it's letting the American people and the people who they're supposedly caring for and providing standards for, that something else is taking precedence. What should they be meeting about, and what should they be discussing? I think they should be really discussing what the data shows, right? And we know that, as been said earlier, the flu test positivity rate is very high. I think it's about 23%. I'm working in a hospital now in Central California, and I don't think we're going to have the data to show this until later, like in most cases, but there is a fear of showing up to the emergency department. There's a fear of showing up to clinics for vaccinations, for not only preventative care, but also when someone is ill. And I think if you look at why do we have public health, right? Why do we have hospital systems? Why do we have government? Why do we have the state? Essentially, it's to make sure that everyone who resides in this state is cared for, and there's a system in place that makes sure that everyone is cared for. I know there's a lot of talk about the mass deportations, and I know that's a completely separate conversation, but we all know that if there were mass deportations, if all undocumented people were asked to leave and they did leave, the economy would crumble. Definitely California, with agriculture being the #1 moneymaker of California. And so we really need to take a step back and look at what the policies are in place right now, and whether or not it's really moving us to become a healthier country, become a healthier state. As we all know, during the pandemic, the way infectious disease works, and there are infectious disease experts here who can speak better than I can on it, but it's a communal effort. And that's how vaccines work. When everyone is vaccinated, there's a huge benefit. When only some get vaccinated, then we see vaccines no longer working, like we see in California with some of the some people who don't believe in vaccines stopped vaccinating their children, and now for the first time ever, we're seeing diseases that were essentially eradicated in the United States. They were not eradicated, but essentially because nobody ever saw them, and now they're coming back. The only problem is, during our training, when we were in medical school and residency, it wasn't something that we were actually could be taught in real life because no one had it.
No one had it. Yeah.
Now this is a huge problem that nobody could foresee, but it goes back to how important communal efforts are in public health and in healthcare systems. And I think what's happening right now is putting us back years, and it's going to take years to recuperate. And so I think the call to action right now is to try to stop this moving backwards and try to look at what meetings need to take place, what meetings should be canceled, and what meetings shouldn't be canceled to make sure that the policies and the actions that are being put into place are ones that benefit everyone.
Thank you. Dr. Neuman, would you like to take that on before we turn to Dr. Turner-Ybarrats for his presentation?
Yeah, absolutely. FDA approval is an essential part of the process of updating a new vaccine. And for a virologist like me, the really nice thing about these meetings is that we get the government agencies showing their data to the public in a way that I or you or anyone can see. And we also get insight on what some of the corporations are doing who are making the vaccines. So they will all give their own presentations, and it is a gold mine of data. It lets you see more or less what is coming and how bad it's going to be. So theoretically, there could be ways that the FDA could approve a new vaccine version without there being a meeting, but that may look like people approving something that they haven't seen or read or really understood. And I don't think the world is any better off for that. I would agree with the other two experts. This looks like a policy decision, and it is one that affects us in a bad way. So we make decisions about health on an individual basis. Should I get vaccinated? Viruses see us as a collective, because if a virus gets into one person, then we seek each other out, and the virus has a much better chance of getting to the second, third, fourth, and fifth person. So a virus's success is determined by how many chinks there are in our vaccination armor, essentially. And there have been a lot lately.
Absolutely. Do you anticipate that similar advisory boards will also be canceled out?
I really hope not. They have the
Yes.
people who are able to do this, and there are a lot of things that we could use an advisory board meeting about. We'll have to see how it plays out, but it is an alarming early sign if things continue in this way.
Thank you, Dr. Neuman. We now turn to Dr. Daniel Turner-Ybarrats. Thank you for joining us. Dr. Turner-Ybarrats will discuss the environmental factors and underlying health conditions which make certain populations more vulnerable to harsher flu infections, and some of the current factors keeping people away from getting vaccinated and going to community health clinics and the ER, and the strategies for managing some of the downstream drivers of health equity. Welcome, Dr. Turner-Ybarrats. Again, a very tall order, but we hope you can do it.
Oh, thank you. And I'm just got off a night shift, so I may not be excessively wordy, but I think that'll be to the benefit of everyone. So I think it's important that we start off with, environmental social factors significantly impact who suffers from the flu, right? So communities with lower vaccination rates, predominantly Latino, Black, and also American Indian populations, face disproportionate risks. And a lot of times when we look at numbers and percentages, we may think, oh, we wonder why there's this accident or this random number that's an outlier. But this is more of a systematic process, because if it was an outlier or accidental, then it would be random. But if every time the numbers are looked at and every time there's a certain group that has lower numbers, then this is more of a systemic problem. And so what's keeping these numbers this way? What's keeping vulnerable communities from seeking care? I think it's, at least in the immigrant community, it's fear. I believe one number that I saw is about 22% are skipping healthcare, necessary healthcare due to deportation concerns. And this is from a survey that was done. The avoidance creates these silent epidemics that eventually affect us all. And so I call it a silent epidemic just because initially you don't see those repercussions. And because of there's a delay, sometimes people lose the connection between the two. And it's a little bit harder to show. But with good studies that are done years after the fact, we do see these connections. And the FDA abruptly canceling the meeting, that move threatens next season's flu vaccine. And so now it's just passing on these unfair environmental factors onto the next season, because if we're not talking about the problem, how are we going to be trying to solve the problem, right? And this is not just poor timing. I think it's dangerous policy that puts lives at risk, especially when we're experiencing such a high, severe flu season. And we know that vaccine saves lives. And so if you cancel a meeting that is essentially going to improve vaccination rates that saves lives, then I'll leave it up to you to see if you can make any conclusions from that, and whether there may be lives lost when meetings are canceled or when improvements are not made. I think that this environment that we're talking about is something that is a public health issue. So flu vaccination rates are low across California. And I think in San Diego County, there was a small outbreak where 4 teenagers who died were not vaccinated. We have significant healthcare disparities, right? So we have the flu vaccination rates in Black, Latino, American Indian populations are below 43%. And these have been exacerbated by the Trump administration policies. So if we're looking at, I think it's about 27% of likely undocumented immigrants and 8% of documented immigrants avoid applying for food, housing, and healthcare assistance due to these immigration-related fears. I want to know who's talking about that, because I really haven't seen. All I've seen now since the Trump administration has taken over, what we see now is more of a fear of funding being removed. And now that there's this overarching fear of funding being removed, everyone is afraid to speak up because nobody wants to bite the hand that feeds them. But if we're not speaking up about these numbers and these facts, what are we going to be speaking up about? Just 2 days ago, there was a huge movement that was passed in the Senate, and nothing in Medicaid has been decreased, but now there's a plan for a huge decrease in funding to Medicaid. That is going to have astronomical consequences across the board, across all races, but especially minority communities, because due to disparities, minority communities tend to have lower income and tend to have higher rates of being on Medicaid. Florida and Texas, I think, are requiring facilities to ask about immigration status. If we had a federal government that, believed in health equity, then we could ask them to ask Florida and Texas not to do that, because we know that that is going to be another barrier to care. But when we have a federal government that's supporting those types of questions in clinics, the question is, what can we do? And that's where we're at right now. I think if you ask most nonprofit organizations and clinics and hospitals, is if you're in Florida and Texas, what can you do? I think it's up to you. If you have a clinic that you decide, should I ask about immigration status? Should I be challenging the state? Luckily, I live in a state that doesn't do that. But if I did live in a state where they're asking me to ask these questions, then we really have to ask ourselves, if you're a physician and you've taken a Hippocratic oath, is what I'm doing not going to cause harm? And I think if you're asking patients about their immigration status, I think that is harm. And as a physician, I would really challenge you to ask yourself, Are you aligning with your Hippocratic oath? And if not, then you need to decide what takes precedence. And I would always say what takes precedence is what's best for the patient, and not what's necessarily being enforced without any type of evidence that it's going to improve care.
Thank you so much, Dr. Turner-Uveris. I have a question before we turn it over to reporters. Are underlying illnesses like bronchitis, asthma, contributors to higher rates of flu that turn into pneumonia, especially for kids and elderly people?
Right, definitely. I think any chronic disease that you have puts you at risk for almost any type of disease. And so if you have diabetes, high blood pressure, if you have chronic bronchitis, if you have any disease that is requiring you to take a lifelong medication or a medication for more than a period of a year, is going to be a chronic disease. If you get the flu if you catch the flu and you have the same age and you're in the same demographics or in the same zip code as another patient, but that patient also has a chronic disease, that patient is going to have a higher risk of complications and a higher risk of death. And so that's another, I think, a good point and thing to focus on is when we're thinking about the flu vaccine, it's not just about vaccines, it's about access to care, access to preventative care, because that's just as important as in reducing hospitalizations and in reducing emergency rooms filling up and reducing avoidable deaths is how can we make sure that our patients are as healthy as they can be in the case that they do contract the flu. And that's really what we should be always trying to focus on, is how can we make our patients as strong, as healthy as possible. So worst case scenario, even they contract the flu vaccine, they're in a position where they're prepared to fight the flu and not be hospitalized or not have any complications.
Thank you. Before Peter Sherman asks his second question, I wanted reporters to note that 2 weeks ago, and I got this from a very good source, there was an ICE van parked outside a community health clinic in Adelanto, which is in the Imperial Valley. So Dr. Turner-Uveris, Peter Sherman has a question related to that, and I hope you can address both of those concerns. Peter?
Hi, thanks, Sunita. I guess just sort of building off of what Sunita had just shared, the Trump administration has removed protections for churches, clinics, schools that previously had been sort of shielded from raids by immigration officials. And that's cast a real sort of fear in communities. There's reports that there's increases in absenteeism, for example, in schools because families are afraid to send their children to school. I'm curious, and I asked this as a father of a son who I had been in a situation where he had fallen very ill. This was some time ago, and I didn't have access to a doctor, and I was just really panicking. And I was fortunate to get through to a clinic and a nurse's advice line. I'm curious, what advice would you give to a parent who's in a situation where they're undocumented, they're afraid to go to the clinic, and they have a sick child? What are some what's some basic advice that you could give them to help alleviate anxiety and to ensure the safety of their child? Thanks.
Yeah, that's I think that's an important question to ask. And is this for a Latino patient, a patient who's an immigrant, or is this in general?
I think undocumented children in general, Dr. Turner-Uveris.
In general, okay. I would say, well, one, get the flu vaccine. Protect babies with the flu vaccine. If they're sick, keep your children at home. General advice, I would say, advice related to structural barriers and policy-induced fear. I think it's important that we have systems in place that assist families and assist patients who have children to get access to where they can become vaccinated, right? I think it's with the high mortality rate and with obvious barriers that we need to have those in place. If someone gets the flu, then you want to act fast and you want to have access to medications, as we know that also decreases the likelihood of complications or unnecessary deaths. We want public transportation in place if that's your main way of getting around, because that's going to be your main way of getting to where you need to get vaccinated. Workplaces, bringing vaccines to where people earn their livelihood, I think is important. And so having like on-site vaccination programs so that you don't have to worry about how am I going to get my child vaccinated. When this day and age, we can find a way to where we can either bring those vaccines to you or very close to you, or bring them to faith-based organizations so that when you're going to be going to church, there's a place where you can get vaccinated, having them at grocery stores, community markets, really just having them easily available in multiple different ways, I think would make it a lot easier and something that we could definitely do. Even in daycare and childhood centers, on-site flu shots at daycare centers have been done. And those places where, state-funded flu shot programs are in childcare facilities, we know that it increases flu vaccination rates and decreases complications. And so I would be trying to push that in my community and in my county and in my city and in my state.
Thank you. There are a number of questions for you, but let's go to Dr. Neuman, and we'll take some of these questions in the final round. Welcome, Dr. Neuman. You're going to tell us how we got here to where we're seeing 29 million cases of flu this year.
Yes, I hate to be the bearer of bad news, but since you asked. So the best year that we have had in recent memory for stopping the flu was in 2020, 2021, and we distributed 48 million more vaccines that year than have been given so far this year. And that year, we nearly suppressed all the strains of flu. Even the ones that are usually more difficult to suppress were stopped because of widespread herd immunity. That has been lacking lately. So I posted a link to a Morbidity and Mortality Weekly Report article in the comments. It's up a little bit. That has the current numbers for how effective the vaccine is. Essentially, the vaccine is working quite well, about as well as usual, against the H1N1 seasonal flu. That's the descendant from the pandemic influenza of 2009. The one that we are not doing as well against is H3N2, and that is usually the more difficult of the two to stop. On the other side, and I see there's a question on this, I think what we are seeing so far from the government, and in particularly Secretary Kennedy, is exactly what he said he would do while he was campaigning on an anti-vaccine platform, and very nearly the opposite of what he said he would do during Senate confirmation hearings. So I think we are seeing essentially the real person. I hope it doesn't go any farther than this, but there have been big impacts, and they're being felt throughout the scientific and medical fields. Science is a slow process. It takes a long time to do the experiments, and we're slow because we have to be careful, and because there's no value in being quick if you're not right. Pulling funding on a moment's notice from projects like this can basically set everything back to square one. If you have vaccinated animals and you need to check how well your particular treatment is working, there's a window. You can only test them for a certain amount of time. And you can't just, dangle funding like a dollar bill on a string to annoy pedestrians. This is, really undermining our ability to plan for the future. And unfortunately, when we see things like that happen, the the consequences will be in the future, and it's always much more immediate if they're happening right now. It's much easier to match cause and effect. But I think there definitely will be an effect, and we are seeing that the sort of attack on science has not stopped yet. I don't know if there's anything else you'd like me to address, Sunita.
I think that's a good opener to a number of questions for both you and Dr. Turner-Uveras. Henrietta Burrows, why don't you go first with the first question that you had asked about the efficacy of the flu vaccine?
Yes, Dr. Neuman, I read that the current vaccine was not quite as effective as it should have been or as it could be. And I'm wondering what's your take on that? You mentioned the different types of flu viruses and one that it was most effective on. And what about the current one?
Yes, this is something that we might be able to tackle at meetings like the FDA meeting that was canceled, unfortunately. So in the past, we used to vaccinate against two types of influenza A and two types of influenza B. With vaccination during COVID, we managed to drive one of those completely to extinction. And so now we vaccinate against two A's and one B. And the second of the two influenza A's, called H3 or H3N2, has always been the harder out. This one is always more difficult because there are more different subtypes and more ways that it can change. It may well be that changing the approach and vaccinating for two different versions of this one and one version of the pandemic H1N1 and one for influenza B might be effective at stopping the spread, but people would have to take the vaccine for that to work.
Okay. Alicia Wang has a question for Dr. Turner-Uveras. Alicia?
Hello. My question is, how long does the effectiveness of the flu vaccine last? What is the best time to get one during a flu season? So me, including me and a lot of friends around me who got a flu vaccine last year, but they still got severe cold or flu. Why it is happening? Thank you.
Yeah, I would say Ben Neuman would be a better person to answer this, but I would say, from my knowledge, protection's about 6 months. The best time to get vaccinated is as soon as the vaccine comes out, because that's when it's best, because as time progresses, the virus mutates, and so the vaccine effectiveness will slowly go down. It's still effective to the end of the flu vaccine, but to the end of the flu season. But the best time to get it would be September or October. Before the flu season peaks, but it's never too late.
And Dr. Neuman, do you want to take that on as well?
Exactly right. Yeah. There's very little that I can add. So the flu numbers have been dropping for 2 weeks, but there have been, this is the second little peak in our flu season. And there have been years when there's been a third, which would be maybe 2 or 3 weeks out from now. So we are certainly not out of the woods. And if there's someone who hasn't been vaccinated, there is still a reasonable chance that it would help. Now, part of the reason why, the common thing that people say is that I took the vaccine and I still got sick. One reason is that there are a lot of viruses, 40 or 50 that I can think of, that would cause something that would feel to you and me like the flu. But if you go and get tested, you can figure out exactly which one of those it is, or at least rule out the obvious suspects. The other thing is that none of these vaccines work 100% of the time. Vaccine is something like a wanted poster. If people pay attention, then you may catch your criminal. It's just a matter of educating the immune system, but there are blind spots and the immune system misses things. And when that happens, yes, you can get vaccinated people that still get sick. The best protection in that case is having all the people around you also vaccinated, because that's where the virus is going to be coming from. And the people who are closest to you in your life are the ones who are most likely to give the virus to you and get the virus from you. So you can build a layer of protection around yourself, a little cocoon of vaccine protection by vaccinating your family and loved ones.
Dr. Neuman, I had a sort of bonehead question for you, which I'd asked as I'd asked you to come on. Can there be a commingling of, say, the COVID virus with bird flu and flu that results in a much more lethal strain, or much more infectious and lethal strain, or is that too far out?
A good virologist would never give you an absolute no for a question like that. We would just say that these things are unlikely. So we know this from the way that we build vaccines. Normally, for the flu vaccine, they will take sort of a standard chassis, like the standard regular flu virus, and they will put on this year's hemagglutinin and neuraminidase, the H and the N. And then they'll try to grow that up, and sometimes they figure out that the parts are just not compatible. It's like taking something like my Kia outside and trying to recombine some parts from somebody else's Ferrari. The parts may look fast, they may be really shiny, but will they fit? Will you get a better car out of it? Usually not. However, the rare occasions when it happens, that's where pandemics come from. So, yeah, viruses try everything, and they try everything quite often. And so they fall into some very unlikely things on occasion.
Thank you. Peter Sherman has a second question. Peter, do you want to ask your question about home visits to Dr. Turner-Uvaris? Peter might have had to step away. He asked, might we see more home visits by doctors for families who are afraid to leave home? I think that's an excellent question. And Dr. Turner-Uvaris, do you also predict that there will be a rise in telehealth services at community health clinics for people who are just too afraid to go actually visit a clinic?
Right. Those are excellent questions. I also wanted to, I think that ties into the earlier question about advice for immigrant families afraid to seek medical care. So when your child is sick, every second counts. But for a lot of immigrant families seeking medical care, there's a calculation they have to make, a risk calculation. Do I take my child to the doctor and risk an encounter with immigration authorities, or do I hope they get better on their own? And the data already shows that Latino children are twice as likely as white children to be hospitalized for flu-related complications, and they're less likely to be vaccinated and more likely to be uninsured. And those aren't biological disparities, right? Those are barriers created by us. And so in addition to what I had said earlier, FQHCs are probably one of the better places to go. And hospitals that have explicit protections against ICE enforcement. Mobile health clinics kind of ties into the telehealth answer. When I was at Los Angeles County Department of Health Services, I did the only and the largest Medicaid pilot with telehealth with predominantly Spanish-speaking Medicaid patients, and I was able to get 75% of my patients on a video visit 7 years ago.
Wow.
For the pandemic. It can be done. Was it easy? No, because a lot of it had to do with hand holding, right? Oftentimes we will tell patients, okay, here's your telehealth appointment. Good luck. That is going to be, filled with problems, right? And there's even some studies that show that Latinos prefer telephone visits over video visits, but I would say that is a bit biased because oftentimes telephone visits are easier than video visits. And those studies, they didn't take into consideration why do you like telephone visits more than video visits? If video visits were as easy as audio visits, would you like to see your doctor? Hands, every single patient I asked that to would say, I'd love to see my doctor. That's why I come to clinic. But that's the one most important thing to the patient is I want to see my doctor, right? And For most, that's in person, right? Nothing replaces in person. There's a connection there that you can't replace via any type of remote device. But if you then had to not have it in person, you had to replace it via some type of technological tool. If you ask most people, and if it was just as easy and didn't take an extra setup and there wasn't an explanation and there was someone there to even help them do it, I would say, I can't say most, but many more than is expected would want to have the video visit. However, for most, it's you have to set it up yourself. You have to figure out the camera thing. And then so anybody over the age of a certain age, including my mother, right? My mother does not like video visits until I set it up for her and did it for her. And then she was like, oh, I actually kind of like it now. But before, she didn't even want to try it because in her mind, it just involved a lot of stress, a lot of complications, and I don't want to do that. And so I think telehealth can definitely, it's an ideal way of treating people because infectious diseases requires contact, right? You need to be in a close proximity to spread infectious diseases. If you are separate, if you're not in the same room, if you're not even in the same, building, essentially you cannot catch, right? You cannot spread the flu. So it's a perfect modality. The unfortunate truth is you cannot get everything that you can get from an in-person visit, right? You can't do the physical exam as well. But I would say many, many, many visits, such as medication refills, patients still come in, many of them come in for medication refills. That can be done via telephone, via video. There's many opportunities for us to integrate this, and it would have a major improvement in transmission rates.
Thank you. We have a number of questions that relate to the same theme, both from Pilar Marrero, Henrietta Burrows, and myself. What do you expect the consequences to be? I think this is a good place to end with both of you responding to this question. What do you think they expect the consequences to be of having RFK Jr., a big anti-vaxxer, as head of the Department of Health and Human Services? Pilar asked that question, and then Henrietta follows up with, when you have a federal health department headed by an anti-vaxxer, do you really think that vaccines will be placed now and distributed in all of the places mentioned? I think that is a very good place to end. Dr. Neuman, do you want to take that first? And we'll give Dr. Turner-Uvaris the last word.
Sure. Vaccination, despite what you might have heard, is not an individual decision. It is a necessary social responsibility. And any kind of anti-vaccine literature or sentiment is basically irresponsible on those grounds.
Right. To add to that, an anti-vaccine activist leading the country's top health agency is not dangerous. It's a public health disaster waiting to happen. Misinformation will be at risk of becoming government policy. We saw what happened during COVID, hundreds of thousands of preventable deaths due to misinformation. Imagine that mindset applied to flu, measles, childhood immunizations. I try not to think about it. Communities of color will suffer first, but everyone will suffer. Vaccine program. Yeah, go ahead.
I'm so sorry. Can we tie it back to what's going on right now in Texas with the outbreak of measles? If both of you could talk a little bit about that, and then Peter Sherman has one last question, and we'll end it. Dr. Turner-Uvaris, do you want to talk about the measles outbreak?
Right. I think that's a perfect effect of what all of this is leading to is a trust in vaccines and science will continue to erode. And when trust in vaccines erodes, no one likes vaccines. I don't like. Who likes to get a shot, right? Nobody. Who wants to go to the dentist and get a cavity filled? Nobody enjoys that process. But we do it because one, we think about it's good for us, and then as Ben was saying, almost more importantly, right? It's good for society and it's good for communities. But when that trust erodes, then there really is no value in getting the vaccine. And when there's no value in getting the vaccine, then you stop to get the vaccine. And what's going to happen? You start getting measles outbreaks, which we've never seen, which I think is a really good litmus test of where are we as far as society, our communities, and trust in vaccines. It's eroded.
Dr. Neuman, do you want to address that? Oh, I'm sorry.
And sorry, what was that?
I'm so sorry, Dr. Turner-Uveris. I thought you were finished, so
I'm done.
Dr. Neuman.
Yes. So in Texas right now, we have not just measles, but also a case of rubella. That's two of the three horsemen of the apocalypse for vaccine denial, essentially. I hope we don't see mumps popping up soon. But exactly as Dr. Turner-Uveris said, this is the necessary and almost automatic consequence of the gradual shift away from trusting vaccines. The vaccines haven't changed. This is entirely smoke and mirrors. This is all about feelings and not at all about science. And that's unfortunate because scientists know how to solve science problems, but we struggle with some of the others.
Thank you.
And I'd like to say just real quick, because I saw some of the questions. I wasn't looking at the chat until just now, but I'll just real fast. Debunking the open border spread disease narrative. So that's not a science, that's fear mongering. Flu spreads in workplaces, schools, and crowded public places, not across borders. The primary driver of influenza outbreaks is low vaccination rates and human to human transmission in enclosed environments. Migrants are already required to be vaccinated before entering the US. Asylum seekers, refugees, visa applicants all must undergo medical screening. So that's all misinformation. Vaccine resistance is more dangerous than migration. And the other issue I wanted to touch on, my Alexa had to interrupt my Alexa from speaking. Flu vaccines work, they save lives. Healthcare should be a safe place. No one should choose between health and legal status. Community-based solutions are our best bet. When the systems fail, we have to step up. Public health isn't about medicine. It's about who we choose to protect. And that's a choice we should always be choosing for us. That's all I have to say.
Thank you so much to both of you. What a terrific briefing with so many questions answered. Reporters, please join us again next Friday. Thank you.